So I think it's really important to understand that BPD is a valid diagnosis and that we can see clear brain biology that underlies BPD. And one of the really hopeful things when we think about treatment is that the brain can change and that psychotherapy, even though it's not a biological treatment, can actually change the way that the brain is interconnected. And we think that actually the brain changes through treatments for borderline personality disorder. So what I'd like to really communicate to families and people with BPD is that actually our brain research offers hope that change can take place and that we don't need to necessarily change brain biology using a type of biological treatment, but actually psychotherapy is really a promising treatment for changing how the brain actually functions in people with BPD. What we know about BPD is that there might be differences in the brains of people with BPD when it comes to the neural circuits that are involved, for example, in emotion regulation. And emotion regulation is one of the core symptoms of BPD and has probably been studied the most when it comes to psychotherapy and also in terms of our understanding of the brain biology of BPD. And so what we can see through emerging research on psychotherapy in BPD is that the brain systems that are involved in regulating emotion might actually improve. And we see not just improvements in people's emotion regulation capacities, but also parallel changes in regions of the brain that are involved in actually representing the intensity of emotion, and also regions of the brain that are involved in actually regulating those emotions. So we can see with the example of emotion regulation how psychotherapy can improve that symptom and also change the underlying brain biology. So it's a question I get from a lot of family members. I have BPD, when it comes to my child, I'm worried. Might they develop BPD? And the answer is that there is an increased risk of developing BPD, and in particular of some of the symptoms that are associated with BPD. Things like emotion regulation, impulse control difficulties, relationship difficulties, identity problems. So we might see some of these things present in family members. The really great thing for people who are aware of this is that we have ways that we can intervene early in life. For many people with BPD, it takes time for them to get a diagnosis and to ultimately actually access an effective treatment. So for people who know they have a BPD diagnosis, they can maybe detect the signs of this earlier in family members and start to intervene early to prevent suffering and to get access to these treatments that can really help. It's both. It's an interaction, between genes and the environment. So for some people with BPD, there might be a stronger genetic component, and in other people, there might be a weaker genetic component and more of an environmental influence. For example, experiences of trauma or other kind of things like bullying that might be present in the history of those people. And for some people, it's a combination of both. Perhaps there are genes that really are more sensitive to the effects of stress. And so we really see an interaction between environment and genes in people with BPD. And it can be quite different from one person to the next, which is why many people with BPD will say, what I look like in terms of my presentation of BPD isn't exactly what other people have experienced. And I think that's really important to acknowledge when it comes to that interaction. when we think about what are some of the risk factors for BPD. Do we see them in family members? And if we see these things both in people with BPD and their family members, we can start to think about what are the ways that those might interact within families, and think about ways that we can intervene, for example, in people who are at risk, so family members who might be at risk of developing BPD. But we're also starting to discover interesting biomarkers in family members. So even though family members may actually, for example, be quite good at impulse control, some of our emerging research is suggesting that their brains activate very differently compared to people with BPD and to people who don't have BPD, that their brains are actually quite different. And what does that really mean? And the way we interpret some of these findings is actually potential resiliency factors and strengths in relatives that might protect them from the ultimate development of BPD. So I think this kind of research is really important also for validating the experiences of family members, and maybe even though their family member might be the one with BPD, they also have experiences that might look somewhat like somebody with BPD, and we should really try to understand their experience as well. One thing that I think we need to be doing a better job of, and by that I mean really doing more research on, is how does the brain give us unique information beyond knowing that the person has BPD when it comes to predicting who's going to benefit from one treatment versus another. And so the research suggests that that having information about brain structure and function is actually helpful to an extent with understanding how well somebody is going to do in a certain treatment, psychotherapy. But we need more. We need more research. So that's one really exciting area. Another thing that has been studied for many years in the area of psychiatry and clinical psychology is trying to understand biomarkers, including at the level of the brain, that are associated with certain psychiatric diagnoses, because we think that might help us to identify genetic risk factors for those disorders. So I think that's a really exciting, interesting area. And part of the reason I'm studying family members is to also identify these biomarkers that might run in families and potentially help us to identify genes. And I also think when it comes to evaluating one model versus another model, such as the BPD diagnosis versus proposed alternative models, that maybe the brain can help us in terms of comparing one model versus another. Do we see differences in the underlying brain biology, and what does that mean, in relation to symptom dimensions? So I think the brain is one piece of kind of a more holistic understanding of BPD and alternatives to diagnosing BPD. I wish we were at the point with our brain imaging technologies and with our statistical analyses to be able to run studies that get really at the core of what we think personality psychopathology is. And in my opinion, it really is the interpersonal and relational component of personality disorders. Up until now, a lot of the research has been on emotion regulation. We think that that's an important piece of BPD, but we've seen comparatively less research on this interpersonal relational component. And I think that that's been partly a limitation of our technologies and our understanding of the brain biology that underlies interpersonal relationships. And so I think it's more that I wish we had that technology available, and we're finally starting to get to the point where we're seeing more research in this area. And I think it's really going to help us to get a better understanding of the brain biology that is associated with BPD beyond emotion regulation, which tends to be really the primary focus, or has been the primary focus for many years. Well, the brain, exists within a social context and an interpersonal context. And so even though it may not seem obvious, psychotherapy really can affect the brain. And not only can it affect the brain, but we've also done research showing that when it comes to cognition, so somebody's ability to concentrate, or in particular, we've studied somebody's ability to kind of control their behaviors. We actually see changes through different treatment modalities in some of these core cognitive functions that have a brain biological basis. And so it may not seem obvious, but really psychotherapies can be effective. There are also, when it comes to cognition, so many people with BPD will say that I have difficulties with concentration and memory. Sometimes these are related to learning disorders and ADHD that we see in people with BPD. And there are treatments that can be effective, these what we call cognitive remediations that focus on trying to improve attention and concentration, that aren't necessarily the focus of traditional psychotherapies for BPD. Even though those therapies might help to improve some of these abilities, they're not designed necessarily to improve all of these abilities. And so I'm a clinical neuropsychologist and I really care a lot about this. And so people who are interested in that can actually talk to their doctors about a referral to somebody like a neuropsychologist who has expertise in that aspect of treatment.